Hello, thank you for joining us with Health Impact Virtual. I'm thrilled to sit down today with Dr. Komal Bajaj. She's an expert in healthcare performance enhancement, simulation, quality metrics, and also you're a physician. So I'd love to hear more about your work and really dive in today to quality metrics, to simulation, to all the things that are important to you.
Yeah,
So
absolutely. Thanks, Janae, for having me. I'm Komal. Komal means soft and gentle in Hindi, although most people wouldn't describe me as such. As you said, I'm an OBGYN physician. I'm honored to serve as the Chief Quality Officer for New York City Health and Hospitals Jacoby NCB, which is a two-campus facility located in the Bronx. I also serve as the clinical director for the systems simulation program, which I know we'll get into, which really sort of helps unpack complex systems to solve problems.
all right. That's a great summary. Just complex systems. It also, I'm really interested in talking to you about all these different topics that you kind of work at the intersection of and bring together. I really want to level set with people, especially, you're working in New York. Talk to us about the impact of healthcare on the environment.
Yeah, absolutely. It's interesting for a lot of New Yorkers, their sort of climate moment was in June of last year. Many of you saw sort of pictures of a very foggy Statue of Liberty due to, smoke and wildfires that were thousands of miles away. And certainly some of you who are listening to this probably also experienced poor air quality as a result. But it's a troubling irony that on one hand, health systems and healthcare delivery entities are tasked with advancing health. And at the same time, healthcare delivery accounts for 9% of the greenhouse gas emissions in the United States and about 5% globally, right? So here we have this sort of interesting duality. And, I have to tell you, I think, when I was in medical school, I learned nothing about climate
Hmm.
really, and the impact of climate change on health. And it wasn't until my now 10-year-old twins, when they were 6, started asking us about our own carbon footprint, these little precocious children. And, it sort of made us think about, well, what is our own sort of contribution to the universe?
Hmm.
And then certainly as a healthcare leader, I was thinking a lot about, well, how does healthcare delivery play a role in all of this? And, the impact of climate change on health is really profound. And I have to tell you, in learning this, some of the things that stood out to me, we often think about, well, poor air quality, asthma, things like that. Really, really hot days, people will think about, well, you need to hydrate more, and the concerns on chronic diseases. But climate change has a real broad impact, including things like mental health, including things like migrations, violence, and certainly, we all are connected by an experience related to climate change as it relates to vector-borne diseases, right? And sort of the changes that we, are experiencing with sort of vector-borne diseases. And so the impact of climate change on health itself is very profound. We know that healthcare delivery is in fact also contributing to climate change. And so, there's a lot of reasons why we need to take a hard look at ourselves. And certainly I'm heartened to see some of the movement that's happening around that.
Yeah. And I think also New York is a leader in that, providing grants and providing funding to improve those initiatives. I'd also love to hear about climate principles and how they integrate with your work with quality and safety.
Yeah, without a doubt. I think that climate action, so getting people, whether it's staff, community, around, thinking about climate and climate action is a really strong way to link quality, safety, and wellness. There was a really interesting study by the Commonwealth Fund where they surveyed a lot of healthcare professionals, all kinds of folks. And what was really interesting was that 4 of 5 said, we think that climate matters and we think that our organization should do something about it. And this was the kicker: 6 of 10 sort of vocalized that they think about where they work, what they choose to do based on sort of the organizational approach to addressing climate change. That is crucial in the era that we live in of burnout and staff shortages. Anything that we can do to sort of not only do great work, but also sort of promote promote staff doing great work is huge. And so, that survey, we're seeing sort of the day-to-day embodiments of that. People feel like more connected to purpose. People feel like they get to release their climate anxiety. And it's a great way of sort of linking people to quality improvement. So what we've done is, really thought deeply about all of our sort of performance improvement agenda and how can we incorporate a climate lens. So either, working towards practices that are higher quality and planet friendly, or the other side of the coin, thinking about how do our quality and safety initiatives promote climate resilience? Because the problem is climate change is here, right? And so while we're working to combat it, at the same time, things like, how does climate impact a process? Environmental justice clearly, demonstrates a lot of disparities. And so, do your processes hold when the temperature is 95 degrees? Who is likely to be the most affected by things like poor air quality or heat, right? All of these things, I think, lend itself naturally to environmental sustainability and climate resilience being a part of a quality and safety agenda.
Right. Is that also part of the national agenda that you know of, or just
So
curious?
there's tremendous work that is ongoing. You're absolutely right. You mentioned some of the New York City levers. There are also state levers at different sort of states. And certainly from a federal perspective, through the Inflation Reduction Act and other initiatives, there are tremendous opportunities to improve infrastructure, and training and education, and structures to promote climate action at the federal level as well. And so it's been really heartening to sort of see, how each of these build on each other.
Right. I'd love to talk more about that, like some of the federal initiatives and the priorities. You've told me some about your ability to bring insights for them and ask, are these measures what matter? And I hear that a lot too. Like, do quality metrics actually help patients? Do they actually help physicians? Like how do you do that? How do you bring that?
Yeah. Yeah, certainly. It's so interesting, right? Like we were just talking about environmental sustainability, which clearly like we're just all starting to figure out, right? Like you could say, well, measuring how much carbon, or greenhouse gases an entity is emitting is one thing. But, how does that impact the community that surrounds a particular institution? And so, what I'll say about quality metrics are they need to exist. They're important, right? How do we know that we're making impact? How do we know that we're moving the needle? Is by measurement, right? At the same time, measurement has a cost, an actual dollars and cents cost. And by focusing on certain things, are we missing the opportunity to focus on others? And so some of the things that, I've been sort of thinking about vocalizing in sort of different forums is exactly what you mentioned, right? Are we really hitting the mark, right? For example, when we are tracking a particular infection, that's a really important measure, right? No doubt. No one wants, needs, deserves a hospital-acquired infection. But how does that translate into someone meeting their own personal goals, right? Not getting an infection is like the baseline, right? Like we want them to be able to get to the family vacation that they wanted to go on, or walk their dog around the block, right? And so I think, many in the community are sort of swirling around. We need to have measures. We need to make sure that they are really helping us advance what we need to advance. And how do we make sure that they're incorporating sort of person-centeredness into what we do?
That's important. I'd also love to hear your insights about how that works with specifically maternal health. Like you're an OB. The US has the worst outcomes for mothers, and that disproportionately affects like, historically minoritized groups. Do you feel like the measurement is helping with that? Like how are we combating that?
I'm so glad that you brought that up. And I think this brings up to me kind of where the movement of safety in general, right? I'm very heartened to see, sort of presidential reports on the importance of safety, additional funding going around thinking about safety. And when I say safety, it's safety of patients as well as staff, right? And particularly as it relates to maternal health, I think, we can and we must do better, right? And one way that I think is crucial in maternal health is really sort of widening our aperture and thinking about long before birth happens, right? Or the sort of immediate postpartum period. What can we sort of do for patients? How can our health systems, our health delivery entities promote efficient diagnostic journeys? And so what I mean by that is, when someone comes in for a delivery and has a hemorrhage or sort of increased bleeding, right? If they're anemic, that puts them at higher risk of all kinds of bad things. Well, what about sort of the opportunity to diagnose that anemia long before and address it long before they come in for birth? And so, I've been thinking a lot about how do we incorporate a diagnostic excellence approach to maternal health, which would include long before patients are pregnant to well after they deliver, right? And so there's, as we think about sort of data collection, as we think about tech tools that might sort of address this public health crisis of maternal mortality and morbidity, right? Some of the things that are going to do the sort of move the needle are going to be the things that can do exactly that, right? And certainly, I've talked with a lot of folks and collaborators, and I'm heartened to see, sort of how things like artificial intelligence, are sort of playing a role, right? In a way of sort of taking these disparate pieces of information, which are seemingly not connected, and in fact, connecting them in a way that gets people the care they need, the treatments they need in a time that they need it.
Right. And it sounds like, better data collection from earlier on is a crucial part of that. And connecting the earlier care to the outcomes is something that I think, healthcare could stand to work on. Um, let's move to another thing that it's a top of mind issue, which is healthcare worker safety. We want to make sure women are able to go to the hospital and have a safe delivery. We also want to make sure that people are safe in the place that they work. And I know that you probably have great experience, you have experience with that. And I know New York and Health and Hospitals is also working on integrating that into their planning. So can you share some of that work?
Yeah, absolutely. I mean, I think that this attention on the continuum of safety from staff and patient, I think is really important. And just even an important sort of mind shift to think that, as you said, right, anyone who walks through our virtual doors or real doors, right, should have the kind of experience that they want to have, whether they're working there or receiving care. And so, I think that the strategies around workforce safety, right, which we know is from talk about data collection, right? There was an article recently that said that within a 40-hour period, healthcare workers experienced, essentially at least 2 episodes, right? And if you sort of, you sort of first define what workforce safety or injuries or violence is, right? I think oftentimes staff's threshold as to what is an episode, right? So much depends on sort of what they're accustomed to, right? And
Wait,
what
what do
is
you mean? What does that mean?
yeah,
Like,
it's really,
like if
really,
you're used to patients yelling at you, it doesn't phase you anymore.
that's absolutely right, right? It's kind of like this interesting thing that happens. You're like, oh, they just yelled at me, right? They didn't spit at me, or they didn't, sort of physically intimidate me, right? It's a sort of this interesting threshold. So I think the first thing is kind of just having open and honest conversations about what does it mean? How do we track it?
Mm.
Right. And so I think that's been sort of a really important sort of piece of our journey. And then the next sort of components relate to making things physically safer, right? Thinking about entrances and exits, signage, different deterrents that exist, right? There's a lot of evidence around this.
It's like industrial design helps, or
You got it. You got it. And then I think there's a big cultural piece to this, which we've seen sort of a lot of, right? Again, coming back to that idea of person-centeredness, if there's a culture where certain questions are asked or certain kinds of behaviors are not tolerated, right? All of a sudden, it's a collective sort of norm, right?
Hmm.
That happens. And so I think that, lots of health systems, are on this sort of journey to make sure that anyone who walks through our doors, right, has the best experience.
Right. How is that developed when you say like, no tolerance for certain things? Is that from a federal level? Is that from an individual level? Is that, the nurses, or is that your health system?
Yeah, well, first it takes all of us, right? And I think that there are certain federal, there are certain levers at, again, city, state, federal levels that can talk about these things, that can provide certain guidance, certain levers to do certain things. But at the end of the day, right, culture and practice is hyper local, right?
Hmm.
The physical barriers, the doors, the how things move, how flow moves, how people interact with each other. Does someone say good morning when you walk in? Right? All of that is hyper local. And so I think it's an interesting, important compilation of both, right? The things that are coming down the pike that sort of promote these activities, and then the leadership and really all of us, right, interprofessionally, sort of modeling the types of cultures and behavior we want to see.
Yeah. I was also reading a little bit about your work with simulation in this topic. And I don't know if you have a story or like, tell us more about that.
Yeah, it's interesting. I never thought that I was going to be a sort of healthcare quality and safety leader, sort of serendipitously. I had been spending a lot of time thinking about simulation. So the use of robots, augmented reality, virtual reality, on one spectrum, or things like, a papaya and a stethoscope. You don't need much to really sort of provoke thought around sort of things that happen in the healthcare environment. And so, often you could often wait for a 1 in 10,000 event to happen, right? Or you can create the circumstances for that thing to happen and then talk about it afterwards, right? And so it's that idea of simulating something, could be tabletop, could be immersive, right? Could be individually, with VR goggles, could be a large team, and then reflecting on it, right? Healthcare staff, our patients, are the experts at how care is delivered, right? And by harnessing those amazing gems, right, those ideas, not only is the right thing to do, right, it's often the most effective or amongst the effective things to do, and it makes people feel great, right? I remember, we talk about maternal morbidity, mortality. We, had some outcomes that we weren't thrilled about. And so, some places might make more policies, buy new widgets, right? But we instead chose to, sort of deploy this methodology of simulation to really understand what's happening, right? And debrief and reflect on it. And it took not very long, just about 6 weeks, for people to really get behind it. Oh, and by the way, I have one other thing to tell you,
Right.
right? And what an agency building thing when someone tells you something. You know what? I really think that if we did this, right, and you try it and it works, right, all of a sudden they're more likely to share. And
Right.
so, I am firmly convinced that simulation and debriefing is not a nice to do. It's not an add-on. It really is foundational to improving and improving systems by sort of unpeeling them and understanding, sort of how they're all put together. And, we're seeing a lot of our sort of trainees, whether they're medical trainees, nursing trainees, other kinds of healthcare trainees. Almost all professional schools have some level of simulation sort of built into their training. And so now here we have a switched on group who's accustomed to these kinds of modalities, who almost sort of, it's normal for them to be a part of these experiences. So why not take advantage of, sort of practicing together, understanding together, right? Healthcare teams, are on all the time, right? Basketball teams have 80 games a year or something like that, but they practice every day, right? And so this is a nice opportunity to really unpack complex systems and understand them. And I really think that the evidence is now, 10 years ago, if you'd asked me, I'd be like, oh, we're getting there. It feels like it's going to work, but now we have tremendous evidence to show that simulation has impact on mitigating risk, improving reliability, and really enhancing relationships.
Yeah, sounds like something that's critical. So last week was the high tech committee met, and one of the comments relates to what you were just talking about with like training. I think it was John Brownstein and others talked about how some of the barriers that people face are really workforce education and change. A lot of the problems that we have, are they technology problems or are they people problems? And I'd like to talk more about that intersection that I think you naturally brought up with simulation. Like, what's the intersection with workforce change and your work?
Yeah, it's so interesting, right? Like I remember a situation where someone called me up and they said, we got this grant. We bought this like really fancy, very technically advanced robot, right? That
Hey,
can,
we love robots.
we love me some robots, right? It can measure how good chest compressions are. It can tell you if you're like bagging someone properly and giving them enough oxygen, right? But they bought the tool, but they in the grant didn't write in for the people, right?
Oops.
Oops. Right. So they just bought a really expensive paperweight, basically. Right.
Mm,
And so I think to me, right, technology is wonderful. It's so crucial. Right. But like anything that we sort of are implementing, there's a few principles I think that come to mind. And these are all sort of things that are make quality and safety amazing. Right. The first is this idea of co-design, right? Who is being targeted by this tech, whether it's staff, patients, or both, and how are they weighing into, sort of the design and implementation. And to me, that's like just such a human component of tech, right? I think the other sort of key piece is like, what's in it for me, right? We all sort of remember the people who were like clutching on to their like Palm Pilots, right? Or their Blackberries. Like, what's in it for me? Don't get me
hmm
wrong, love me a Blackberry, but like things have moved on, right? And so, I
Gossip
think
Girl was a while ago.
that's right. I know. But I think like understanding, right? Like, well, why is this change happening? Right. Sometimes it's a regulatory lever. Sometimes the evidence suggests this is better. Right. Sometimes it's we got a grant or we want to try something. Right. But at the end of the day, I think unleashing people's intrinsic motivation by really sort of being clear on why, because oftentimes solutions, beautiful, brilliant solutions, will be plunked somewhere. And then you're like, now what? Right. Like,
Right.
what do I do with this? Right. What is being taken off my plate as a result of this being put on my plate or given to me to use?
Right.
Right. And I think the other thing that, two sides of the coin. First is, I think we need to learn and be okay with not everything being a home run right out of the gate.
hmm
Right. So this idea of sort of piloting and iterative exploration and understanding and tweaking and modifying. And I think that sometimes there's a lot of pressure naturally, right? Got to get it out of the gate, right? But the point here is that humans are messy, they're amazing, right? And sometimes things don't go as planned. We've all been there, right? Sometimes things don't go as planned. And so being above board about this idea of sort of iteration, things that may not be a home run right out of the gate, I think is really crucial. And the flip side of that is, when people share successes, the first question I want to ask them is, how did you do that? Like, how? Not just like, oh, we implemented something. Like, tell me the granular steps. And I think that, like, I wish that more leaders would unpeel and unpack that sort of journey, because it's not a straight line, right? It is a little bit of this. And I think the how people do things, which will involve amazing humans, is a key part of that.
Right. Well, do you have the story of how you've solved a problem that you want to share? Just thought I'd call you out.
So many problems. It's so interesting. Like when I
Pick
became
one or two.
when I was asked to be chief quality officer, it was really interesting. They were like, "Oh, you'll have an EHR implementation. There might be a joint commission site visit." right? And then, who would have known like sort of all
They
of the
said it with a low tone, like it was no big deal,
like
right?
NBD, right? But in fact, there was a pandemic that
Just so
happened,
you have
all
like
these
a
other
small
things.
EHR implementation.
That's right. A tiny little thing. So tiny little thing. Well, I think that I will share a story with you that I think ties together this idea of iteration, this idea of community partnership, and this idea of, quality and safety promoting planet friendly practices. So, COVID naturally disrupted a lot of things for a lot of people, and some things have sort of gone back to baseline, whatever that is. Some things have gotten worse, some things have gotten better, right? And so, an unfortunate thing that happens when patients, for whatever reason, pass away in the hospital, sometimes those decedents, there's a delay in the decedent being released to a funeral home, a religious organ, whatever sort of wherever their sort of support, their family, their loved ones, whomever, decides. And there's a lot of reasons for that, right? In New York City, but really beyond New York City. Funeral homes and other institutions are overrun. The economics of, paying for a funeral, a burial, a cremation, whatever, are not minor, right? And so there's some sort of administrative backlogs. So there's a lot of reasons why across the country some institutions are sort of having a delay in decedents. And so we had an above what we would have liked decedent release rate on average about 2 weeks, right? And that delays grieving. That causes a lot of operational challenges, right? But when families are unsure what paperwork they need, right, to fulfill whatever they need, right, there's a lot of barriers, right? And so we did a lot of things, including working with our community partners, so our funeral homes, our religious institutions. We spoke to patients, and patients told us all kinds of things. I am not sure what website I need to go to. I don't speak English, right? I need help paying for the funeral, right? There were a lot of different things that came out as a result of talking to patients. And so we built different structures around and different, even down to like a packet for people that kind of explains all of that. Through that process, we were able to improve decedent release rate such that 100% of decedents are released within a week. So about halving that period, right? Staff who work really hard but don't often get a lot of attention, right? Like the morgue doesn't get a lot of attention, right? The ICU, where lives, like oftentimes where lives are saved gets a lot of attention. And not only was that great for our community, for our operations, it also saved a lot of carbon because we did not have to trigger refrigerated trucks when the morgue itself was full.
Well, that's
So
important.
heavy.
I mean, you hear a story about that from COVID, like it was a disaster.
Totally. But those trucks still exist and people need to use them for lots of reasons. So here we have a situation where staff feel better because things are moving. Our patients and our community feel better, right?
Right.
And we have sort of operational efficiencies and a climate savings, right? And so how do we do that? Some of the actions I described, but underpinning all of that were the human side of change that I talked about, co-design, unleashing intrinsic motivation, right? The first time we tried something, it didn't work. We had no change, right? No change in operations. So we had to be like, well, why didn't that work? Let's learn, right? So we learned, iterated, and that's how we got to where we got, right? Again, the journey is always like this, never completely linear.
Right. I think that's important to remember. Like, you will have failures on your journey. And I'd love to wrap up with you sharing what you're looking forward to. Like what are you looking forward to solving next?
Yeah, there's so many things to solve, right? I just want to honor, sort of the multitude of challenges, from financial constraints, operational constraints, human resource constraints, and challenges that exist for health delivery entities and for patients who are interfacing with those health delivery entities. With that said, I think that um, I'm heartened to see the attention, as was mentioned previously, in our sort of policies and in our political decision makers on quality and safety. Recognizing that, we all play a role in sort of doing better and being better. I'm really excited about some of the tech tools that exist. As a quality and safety leader, I'm very mindful of how do these, sort of promote great outcomes for all, and sort of what are the challenges to equitable care outcomes that these tools will hopefully advance, right? And if they don't, how do we iterate so that they do? And then I think the emphasis on, climate action and how climate action can link quality, safety, and wellness is something that for me, just as a human, as a mom, as a healthcare leader, it's one of those things where, again, right, like it feels like it's overwhelming sometimes, but 1% better each day, each quarter adds up to a lot.
Right. And then you can give your kids the answer that your carbon footprint's going down.
That's right. That's
That's the
right.
goal. Well, thank you so much for your time and for meeting with me today. And thank you also for your work in this space.
Hey, listen, thank you for having me. And thanks to all for listening. We all play a role and we can do this.